Today, the tables have turned, and I, the student, will be diagnosing the doctor. Dr. Hannibal Lecter, my personal favorite character in my favorite movie. First off, who is he? A vital role in The Silence of the Lambs, Dr. Lecter is a former psychiatrist. In prison for manslaughter and cannibalism, Lecter helps the FBI on the whereabouts of a serial killer who was once his own patient. I have diagnosed Dr. Hannibal Lecter with antisocial personality disorder, characterized by a pervasive pattern of disregard for the rights and safety of others. Unfortunately, we don't have information on Lecter's childhood, so we don't know what his symptoms were like prior to now. So, what symptoms is he showing? First, deceitfulness. Lecter prefers to speak in anagrams and aliases while he speaks to Agent Starling, giving names like Hester Moffat, an anagram for the rest of me, to reveal a severed head in a storage unit. Second and third, aggressiveness and disregard to safety. It does not take many scenes to see that Lecter is a very violent man, and even if he weren't a cannibal. Lecter's visitors are warned to stay very far away from his cell's glass casing. Fourth, failure to conform. He was responsible for many murders, and let's face it, cannibalism is really not a good example of conformity. Fifth, lack of remorse. Lecter approaches his cannibalism with humor rather than any remorse or regret to any of his victims. Of course, Lecter does not possess all of the symptoms. He displays a distinct lack of impulsivity because although he is a killer, he is incredibly intelligent and he thinks out every single idea he has, so it works accordingly. Given his compliance, I believe the most effective course of treatment for Dr. Lecter is cognitive behavioral treatment, which focuses on distorted thinking like selective thinking and overgeneralization. He needs counseling to alter his thinking to change his destructive behavior. And he is very intelligent and able to communicate, so he doesn't need electroconvulsion therapy. I don't believe any medications would help him because he isn't manic, depressive, nor does he show any issues with anxiety. However, this treatment could only prove to be effective if Lecter complies. Unfortunately, Lecter is very content with his way of living and outsmarting. And as a former psychiatrist, it would be very easy for Lecter to say whatever his doctors wanted to hear. Hannibal Lecter is far too intelligent and content to comply with treatments. If he was willing, I think a prefrontal lobotomy may be a good last resort, since the frontal lobe is responsible for personality and decision-making. Overall, compliance and desire to change plays the biggest role in treatment. Therefore, my projected outcome is no improvement due to lack of compliance. So there we have it, Hannibal Lecter diagnosed and treated. Alright, so, Lecter is definitely not real. So how real was his disorder portrayed? Well, it was actually portrayed pretty well. Of course, having this disorder does not make a person a criminal, or an ingenious cannibal. Well, I'd love to stay and chat longer, but I'm having an old friend for dinner.